Welcome, and thank you for attending today's training and for your interest in volunteering with LBDA. I am Toy Scaife Rooks, the Volunteer and Program Coordinator for this organization. Today's class is the first step in identifying what opportunities there are to volunteer with LBDA. To that end, we will discuss the following: why LBDA exists, what we do and why, and what you can do to help the LBD community. In this training, we will talk about our history, what types of programs and services we provide, our standard volunteer practices, and how you can help us progress in our mission. Following today's training, there will be an opportunity to download a copy of our volunteer handbook to review at your convenience. LBDA is a nonprofit organization dedicated to raising awareness of the LBD dementias, supporting people with LBD, their families and caregivers, and promoting scientific advances. The association's purposes are charitable, educational, and scientific. LBD families are at the heart of our mission. This organization was formed by caregivers' personal experience, and our board is still made up of many LBD caregivers. Our programs and services help us move towards these visions and goals in some capacity. Ultimately, we are here to lift the burden of LBD families. What exactly are our programs and services? Let's start with education. Education for LBD families, the general public, and healthcare professionals. We leverage the internet heavily as we are still a very small organization. The website has all of our educational resources on it and is our best educational tool. Through it, we serve hundreds of thousands of people each year. Our newsletter is a great way to stay up to date with what's new at LBDA, including research news, educational resources, events, and new support groups. All volunteers receive the Lewy Body Digest automatically. LBD families typically feel very isolated, not just because of their busy caregiving duties, but because they may not know anyone else in their community dealing with LBD. Our job is to help them feel like they are not alone by connecting them with each other and others who understand what they are going through. The LBD Caregiver Link provides a peer-to-peer service connecting individuals with an LBDA volunteer via phone or email. Caregiver support groups are community-based and facilitated by either an LBDA volunteer or relevant professionals like social workers, nurses, and long-term care professionals. Our online community connects people across the world who have been touched by LBD. Our discussion forums are organized by topics such as clinical issues, research news, living with LBD, and regional networking. We also have a category for caregivers to go off-topic for social exchanges. The forums are moderated by an LBDA volunteer. Thanks to one of our fabulous volunteers, our social media has grown tremendously over the past 2 years. Some of our programs are long-term in nature. We have a remarkable group of LBD experts who volunteer their time to ensure LBDA is a credible resource on clinical and scientific matters. In collaboration with the Scientific Advisory Council, we issue research grants, organize scientific meetings on LBD, and interact with federal agencies, corporations, and other disease advocacy organizations. As you can see here, The Scientific Advisory Council provides us with expertise in a wide variety of LBD clinical and scientific areas. Now that you know a little bit more about LBDA, let's talk about what it means to volunteer with our organization. Most people don't realize how small LBDA is. While we have a national scope to our programs for the disease with a patient population of 1.3 million Americans, we are incredibly small. We have a total of 6 staff people and a volunteer base of about 200. This includes our board, our Scientific Advisory Council, and all other volunteers. At that size, you can imagine how much we rely on our volunteers to help us serve LBD families. We find that the best volunteer relationships start with clear expectations. Let's talk about what LBDA needs from our volunteers. Listed here are volunteer opportunities that are available with LBDA. We will talk about each of them more in detail. The LBD Caregiver Link is a great opportunity for volunteers who work one-on-one with people touched by LBD. We have a need for about 10 more volunteers for this program. The role of a Lewy buddy is to return phone calls to caregivers who have questions or who simply need a listening ear. Normally, we are referred only 1 to 5 calls for each month for each Lewy buddy within your region. If a volunteer in a neighboring region is on vacation or away for whatever reason, you may be asked to help fill in while they are away. It is important to understand that you do not have to have all of the answers. There may be times that you are unable to answer certain questions from callers, and that is perfectly okay. There is an escalation process that allows you to forward calls to a staff member or lead support volunteer. This position is perfect for retirees or for people who work less than full-time, who can occasionally spend 10 to 30 minutes on the phone with individual caregivers. Because this role requires you to listen compassionately to people who are going through a difficult time, it is also not recommended for those who are still in the grieving process. You need and deserve time to heal yourself before you can offer your energies and compassion to someone else. Support group facilitators are needed all over the country to launch new support groups. If you can spare one evening a month and a few hours a week, you can start a support group. The best facilitators are organized, are good listeners, and are very friendly. And you don't have to do all the work by yourself. We encourage all of the support groups to have a facilitator and a co-facilitator, which can be a member of the group or another professional in the aging field, like someone from a long-term care facility where the meeting is held. This is a great role for part-time caregivers, people who are no longer providing care to someone, and people with relevant professional skills. Because this role brings you face-to-face with people who are in emotional pain, this may not be recommended for someone who is in the grieving process or has recently lost someone with LBD. Do you like to spend time on the Internet? LBDA may have the perfect role for you. We need individuals to help keep our forums welcoming, orderly, and organized. Please note that this position requires 30 minutes, 1 to 3 hours a week. About 5 moderators are needed to cover the full forum. We currently have several openings for forum moderator position available. The more you can help LBDA grow, the more programs and services we offer in pursuit of our mission. We need volunteers to help promote our mission to the general public. So what better way is there than to do a fundraising event? These generate great media coverage for the disease. The bottom line is you set a fundraising goal, you choose the type of activity you would like to organize, and we will provide you the tools and the resources to help your event successful. It doesn't matter to us if you raise $25, $25,000. Every dollar would help serve LBD families and raise for research. You don't always have to organize a whole event on your own to raise money for LBDA's mission. We have some great suggestions on raising money virtually and through existing events in your community. No matter what your volunteer role, we sincerely hope that you consider not just donating your time, but also help us raise money for LBDA's mission. Some other roles for volunteers to consider require more specialized experience or skill sets. We are seeking executive-level professionals to help advance LBDA strategically by serving on our board of directors. Individuals with significant personal influence are desperately needed to help LBD get the attention it deserves as a public health issue. We also need professionals with experience in finance, insurance, public relations, governance, and fundraising to serve on committees or provide in-kind services. Volunteers are often the face of LBDA to LBD families, so we need volunteers with a positive attitude who are knowledgeable about our organization. Dependability is a must. We ask that when you agree to take on a volunteer responsibility, that you follow through with them to the best of your ability. We serve LBD families, which means that they share a lot of personal details with us about how LBD has affected their lives. They deserve our compassion and our confidentiality. So LBDA volunteers must be able to keep those confidences. As a nonprofit organization, we are bound by professional, legal, and ethical guidelines. We ask that our volunteers uphold these same standards. LBDA volunteers are free to volunteer any number of hours they wish, any program, and at any event. However, you must inform program leadership and volunteer court of these hours and prove with your commitments. And remember, when you are working with LBD families, they look to you as an expert and as a resource to help them find what they need. Many of these resources are available through LBDA, so please stay up to date with what we have to offer. Upon completion of this training, we ask that you please click on the volunteer application link. This is an important next step in our process. This ensures that you are added to the volunteer database, puts you on our e-newsletter mailing list, and allows you to receive important volunteer-only information. Once you have registered as a volunteer, you can download the volunteer handbook and review it at your convenience. The volunteer and program coordinator will contact you within 2 business days. On this call, you will learn more about specific roles, what is required for their training, and answer any questions that you may have about LBDA's volunteer program. My contact information is Toy Scaife Rooks, Volunteer and Program Coordinator. I can be reached via email at lrooks@lbda.org, or you may call at area code 404-935-6444, extension 104. Thank you again. We look forward to working with you.